Okay. Good afternoon to you all, and thank you for joining me this afternoon to allow me to provide you with an update concerning the Hamilton Health Clinic. The health center has been under stress over the past month due to a number of structural problems with the facility, and most recently, for example, the fire at the Wart Clinic, 3 floods at the Hamilton Health Clinic, water quality, and several unsuccessful attempts to resolve the problems. The Department of Health Management and staff, as well as Public Works, are working together to find the cause of the continued problems and hoping to restore operations to the health clinic as soon as possible. This morning, staff gathered outside of the health clinic to air their concerns with management. The meeting could not be held indoors because the building is not operational, but an open and frank discussion and dialogue occurred, which was held with the executive management, and we appreciate the concerns that were raised by the members of staff. The primary challenge is that the maintenance teams have been unable to repair the problems and restore the facility to minimal operations. Staff and management are equally concerned about the impact this is having on our patients and the uncertainty of service provision, and we are working to stabilize services in relocated venues. There are also concerns with previous structural problems, and repairs are underway which are not yet completed and were disrupting services before the health center's closure. We are escalating this to ensure that the repairs can be completed as quickly as possible. We appreciate the staff's frustration at this time, as this has been going on for a period of time, and there is no end in sight at the moment. We are deeply appreciative of their patience and understanding and share their primary concerns as it relates to the impact of the closures of the Hamilton Center on the patients to which they service. On a longer term, the ministry and the government will have to reconsider the adequacy of the health center to meet the needs of public health services. This will be an ongoing discussion, but at this moment, the priority to stabilizing services to the public and restoring the health center, the Hamilton Health Center, to full operation is of paramount consideration, our number one priority. Further announcements will be made to the public as it relates to the relocation of services whilst the repairs are being conducted. Thank you.
Any questions from the media?
Good afternoon.
Good afternoon, Mike.
What exactly is the problem? We're hearing pipeline, plumbing, water. What exactly is the problem at the clinic?
Well, all 3 of those are actually interconnected. The building itself is quite old, and the piping is primarily made up of galvanized pipes. And during the course of a flood that occurred several weeks ago, they recognized that the galvanized pipes were in poor condition, and they had to start replacing some of those piping with the new PVC pipes. So the problem really is contributed to the galvanized pipes, which are being replaced, and it was a run-on effect from that because, of course, when the pipes busted, the pumps busted, and the pumps had issues with the pumps because of the plumbing issues concerned directly as a result of the galvanized pipes. But Works and Engineering are working with us diligently to try to repair all of that so that we can have the services operational as soon as possible.
Mm-hmm. Tell me, did I hear correctly just now? You said that maintenance unable to repair damages and you're relocating?
Yes, that's correct. As I indicated, Public Works are assisting with respect to the maintenance. However, again, primarily because of the issue concerning the galvanized pipes, when they have reached a resolution and they feel like the matter has been resolved, then the next day there seems to be another pipe busting, and the pipe that's broken is the galvanized pipes. However, because of these issues, the Hamilton Clinic has been closed. However, the services with respect that are offered by the Hamilton Clinic have been offered, but in various locations.
Are you at this stage able to say where exactly, because you're talking a lot of different departments?
Absolutely. Yes, and there have been public communications that have been issued to tell the public and inform them of the locations, but I can say with respect to the STD clinic that is currently being housed at the urgent care facility. The St. Paul's Church Hall is housing the travel clinic and the shots clinic. The As recently as about 2 hours ago, we had communication from a owner of a commercial premise here in central in the central part of Hamilton, and they've indicated that they will allow us to operate the maternal health clinic out of that. So again, there are a number of contingency plans that we're working on. We're trying our best to have minimal impact on the services that the health clinic offers.
Can you give me a timeline as to when the ministry found out about the issues with the facility?
The recent episodes with respect to the floods, I believe it was in September, when the staff obviously presented themselves to work. They noticed that there were flooding and so forth, and they contacted the ministry accordingly. We, in turn, have been working, as I said, with the Department of Public Works to have it resolved. The government is very much committed to providing the services of public health. We know it's a very important, critical area of service that's provided that public members can have access to. And the fact that the services have been temporarily displaced doesn't prevent the continuing operation of the services. We're just regrettably not all located in one facility like we were previously, but we are working diligently to effect the repairs of the structural damages that were caused by the flood. And as soon as that's been completed, then we will be able to relocate all of our services housed in one central location.
In the meanwhile, is there any plan to sort of move those clinics around? Because obviously a clinic in St. David's might be fairly difficult for someone to reach if they happen to live in Sands.
That is correct. We do have, like I said, we're trying, we found that in the meantime, it's probably best to try to have the facilities centrally located so that persons can come into Hamilton. You would have heard on Monday, we reopened the dental clinic in St. George's, which has been closed for almost 4 years. So that service is now opened, and we're pleased that we're able to offer that type of facility to the residents in the East End with respect to dental, as well as the seniors that are housed at Sylvia Richardson right across the street. But at this point, there are various locations. We're looking to ensure that they are centrally located until such time as the Hamilton Health Clinic can be reopened for operation.
No further questions? One more. Cynthia.
I didn't want to ask you this, but I have to. Minister, is it too early, is it premature to give an estimate on what do you think it's going to cost to get all of this piping and pumps and things fixed?
Unfortunately, I don't have that answer in front of me. I don't have that information.
Okay. Thank you, Minister. Thank you.
Thank you.